Thank you, Professor Carr. First two sessions, I was unable to hear the first session, but second session has been very valuable. And I, on the behalf of Policy Perspective Foundation, welcome my guest, Shri Vyas ji, who is Vice Chairman, State Chairman of this State Disaster Management Authority, Bihar.
Yes. Yes, Mr.
Welcome, welcome Vyas, and I also welcome our audience over here and our listeners over here. This will be a very valuable, I'm sure this will be very valuable for our audience and other people who are listening to us and have joined us. So, Shri Vyas ji, first of all, I would like to request you to start with your thoughts and share your valuable thoughts. As a go ahead for the India, from how does India move ahead from here?
Thank you, Mr. Sharma, and good afternoon to all the listeners. Because COVID-19 has been declared as a disaster, and it's a pandemic, of course, and Disaster Management Act has been invoked in the whole of India. So to begin with, I would like to start with what is the meaning of disaster which has been given in the Disaster Management Act, which was passed in 2005. If we go by the definition, the strict definition which is in section 2, subsection D, which defines disaster. Disaster means a catastrophe, mishap, calamity, a grave occurrence in any area arising from natural or man-made causes, or by accident or negligence, which results in substantial loss of life or human suffering, a damage to destruction of property, or damage to a degradation of environment, and is of such a nature or magnitude as to be beyond the coping capacity of the community of the affected area. We are working in the disaster management field. Personally, I am working since 2009. It's for the first time that this section 2D has been invoked to define this pandemic as a disaster. As a health secretary, we knew about the Epidemic Diseases Act, and under the Epidemic Diseases Act, all kinds of steps were required to be followed. I think when plague was in India and even cholera had created havoc in most parts of the country, and this influenza, the Spanish influenza, which happened during World War I, then this Epidemic Act was also passed by the Britishers. But for the first time, when you define pandemic as a disaster, I think not many disaster professionals or disaster management professionals may be present in this audience. It's a news for all of us. For the first time, it has been defined as a disaster. If you go by the strict explanation of the definition, how it defines, then so far no one has ever considered any disease or any health hazard as a disaster. So in Bihar, we always found that at times the JE or AES, then in the UP, Japanese encephalitis. In our parts in Bihar, there are a number of districts which were affected by acute encephalitis syndrome, and many people, children died and incapacitated, but it was never considered that it can be covered under the Disaster Management Act. This Disaster Management Act is a very, so to say, explicit act, and it would now open so many avenues now that if there is any epidemic, then one can declare it as a disease, not as a disease to be controlled under the Epidemic Diseases Act, but also under the Disaster Management Act. This act under Section 6 gives power to the NDMA to issue guidelines, plans and policies, and under Section 10, the National Executive Committee has been empowered to assist the NDMA in the disaster management and enforce the directions given by the central government in control of the disasters, the regulation of the disasters, management of the disasters in the whole of the country. So once the government has decided that now the health hazard of this nature is a disaster and whole of the country is under the lockdown and it's being managed as a disaster, I should look at the health system resilience from the viewpoint of a disaster management professional. The disaster management now has also been defined under section 2 and subsection E of the Disaster Management Act. Now let's start with the first, the first step which has to be taken in context of any disaster. That is the prevention of danger or threat of any disaster. That is the first step. That one has to concentrate, one has to focus, one has to devise the means and ways for prevention of any disaster. Second comes mitigation or reduction of the risk, that is the disaster risk reduction. Third one is the capacity building. One has to build the capacity of the systems. Then next one is the preparedness to deal with any disaster. This preparedness aspect is very important and it has been in fact time and again emphasized while we were dealing with the natural or the man-made disasters. And also, of course, for the diseases, it was very much there, but not in the sense of a disaster management exercise. Then comes the prompt response to any threatening disaster situation or disaster, and then assessing the severity or magnitude of effects of any disaster, and then comes rescue, evacuation, relief, and then rehabilitation and reconstruction. So if it's a disaster, and now it's a disaster because Government of India has, under the Disaster Management Act, decided that it is a disaster, and all of us are dealing with this disaster, then from the viewpoint of disaster management, I think the health system has to be seen. How this health system can be strengthened in the future because of this COVID-19 experiences. Prior to that, health system was working, and wherever health system was working in a very fruitful manner, in a very effective manner, just like people say that in Kerala, health system is very resilient, and health system is working since ages. They say the control of or not prevention but the mitigation and management of the disaster of COVID-19 has been applauded by all concerned. So health system has to be now strengthened. Institutional capacity of the health system has to be built in view of this disaster, in view of other health hazards which may turn into disasters in the future. And we are not sure how many more viruses are lurking and how many more viruses in the future would threaten the mankind. Now, if we talk about the health system building and building its institutional capacity, it is not the case that for the first time it is being considered. I think right since the independence, the governments of the day were concerned with the building of the health systems. But now the necessity of building the health system and increasing its capacity, the institutional capacity, has increased manifold because of this COVID-19. In number of states, we are finding that the beds are very short. There's shortage of beds. There's shortage of so many equipments. Shortage of PPEs. Shortage of the instrument for which one can fight this disaster. So the necessity of strengthening the institutional capacity is much more, and this is much more not in the context of the present COVID-19, but in the future as well. Now, National Rural Health Mission, when it was in fact operationalized way back in 2005, 1995, it has thought about certain health standards, and which we call the Indian IPHS, we call that Indian known as public health systems. Just the speaker prior to me talked about the public health professionals. In fact, this IPHS standards, they talk certainly about the public health. And when the public health systems has to be strengthened, it has to be strengthened from the grassroots. The first interaction of any villager takes place at the health sub-center. This health sub-center, as per the IPHS standard, has been defined to possess certain skilled manpower, certain equipments with certain functions. It also says, IPHS says that for a population of 3,000 to 5,000, 3,000 in the tribal and hilly areas and 5,000 in the plain areas, there's a need of establishing one health sub-center. Now, it talks about the manpower which is required over there. They talk about the two persons. Two persons, one is a female worker, and basically that female worker is an ANM, and then they talk about male health worker, and gives certain functions to these centers. In my opinion, after declaring COVID-19 as a disaster and assuming that in the future such disasters would certainly harm the mankind, there is a need of strengthening this health sub-center, which is at the grassroots level. This grassroots is very important. And from the viewpoint of disaster management, if prevention is also, these activities of prevention is also included in the functions of the health sub-center, then we need to strengthen the capacity of the health sub-center. The extension workers is a need of, rather positioning the public health professionals, which would be certainly the health workers. They have to visit the villages, they have to interact with the panchayats, and certainly this prevention aspect of the health hazard has to be taught to the villagers, to the panchayat level. And if it is in the urban areas, then these health professionals, they have to interact with the ward members, and the ward people who are living in the ward, because they are, extension services would change the behavior of the people. This behavior change communication becomes very important in the context of such disasters. Just we heard that a simple thing called hand washing. This hand washing is, we belong to the families where when we were children, we were taught that when you are going to take your food, you have to wash your hand. When you come from your toilet and all, you have to wash your hand. So this hand washing has been part of our habits. But what I'm realizing that under this COVID-19, it's being said day in and day out that we should wash our hand, we should wash our hand in this manner. What does it mean? It means that washing of hand has not been inculcated as a habit, amongst the Indian population. Why it has not inculcated? Because of so many factors. For example, urbanization, people just sanitize their hand, they don't wash their hands. People when they go for the eating, they use the fork in the urban areas at times, but the villages they use hands. So this very simple preventive measures, which if not adopted may cause a lot of health problems, health hazards, should be taught to the people right from the very beginning at the grassroots level. And for that, I think the strengthening of health sub-center becomes very, very important. I'm emphasizing on the preventive aspect of the healthcare because we give too much emphasis on the curative part. We keep on opening a lot of hospitals here and there, a lot of the beds are being increased, but side by side, this preventive aspect is very important. And in order to ensure that this preventive aspect becomes part of one's habit, one the health system at the grassroots level has to converse with education, with the schools, with the Anganwadis, you know, with the sanitation and hygiene workers, you know, with the panchayats, because the ASHA is with the health department, Anganwadi workers are with other departments, social welfare department at the state level, and sanitation and hygiene is being looked after by the PHED. They also look after the water, potable water. If potable water is not there, or if by chance, if the water which is coming out of the hand pump, because mostly people in the rural areas use hand pump, and in the urban areas they use the pipe water supply. Now everywhere, government schemes have been launched to supply the pipe water, but that pipe water or the water from the hand pump has to be potable. If water is not potable, if water is not drinkable, then certainly there would be health problems, So at the grassroots level, if there is a checking of, there is water, then certainly the health hazards can be contained at the grassroots level. And it would become part and parcel of the habit. So my argument is that to begin with, the strengthening of the health sub-centers would be the key to fight the future disasters related to the health, and also to ensure that people adopt good practices, good health practices, and it becomes part of their health. This health sub-center, the function of one of the important functions of the health sub-center is to contain the diseases. For example, child and mother care. With the child and mother care, it is also very important that the staff should be trained. There is a need of constant training of the staff to also kind of check, say, BP. They can check the BP, they can check the sugar, blood sugar levels, because the India is going to be, as we say, the diabetic capital of India. So from the very beginning, if at the grassroots level, the blood sugar is being checked, if the BP is being checked by, and these people can very well be trained to check, these parameters, and through telemedicine, if they share it with the doctors at the PSC level, at the CSC level, certainly whatever advices are rendered with the doctors, that can be transmitted very easily at the grassroots level. So the point is that one has to build the capacities at the grassroots level, at the health sub-center level, at the PSC level, at the CSC level, at the district level, in some places like in Bihar, you got at the sub-divisional level as well, and of course at the medical college level, for which IPHS has laid down, standards and all. Now, there's a need first of building. One has to build the capacity. When build capacity means one has to, infrastructure is important, equipments are important, manpower is important, and training is very important. This personal management aspect. What we have realized while working in the field, in the health sector when I was working, this training was a neglected area. Now, if training is a neglected area, and if the capacity is not built, on the continuous basis, then the health staff, they fell short of, the capabilities we required, of them. So there's a need of continuous capacity building to the training aspect, which is, I think, very important in the context of COVID-19. Equipments are very, very important in the context of COVID-19 and other disasters, which, for example, AS, is very important that one should have at the grassroots level, at the district level, at the sub-regional level, at the PSC level, at the CSC level, all these arrangements for the future. Now, the first was the build, second is the strengthen. Whatever has been built has to be strengthened on the regular basis. We have found that the things are built, and whatever is, even buildings are constructed, even staff is recruited, but the strengthening is not taking place. So it's a continuous process. First build, then strengthen, and then expansion. Because resources are required, of course. Without resources, you can't build, you can't strengthen, you can't expand. But resources are very much important. I will come to that, those resources, how those resources can be arranged. NRHM and now NHM provides resources to the states. Now, those resources have to be increased in the context of the state's requirement. I mean, you can't compare the populous state like UP and Bihar with, sparsely populated states in India or the developed state of India. The populous states certainly would need more resources, because their system, because of historical reasons or because of whatever region one ascribe to, their requirements are much more. So NHM has to kind of allot money in the context of the requirements of these states, and also the states have to raise the resources. They cannot totally dependent upon the central government. So health cess, for example, in Bihar, I was looking after the revenue department. We are charging education cess, in the form of land rent. So health cess is very important. One can raise resources through health cess. Whatever taxation the state government kind of imposes, there shall be certain percentage known as the health cess that would come in the consolidated fund of the state, and that fund can also be used along with the NHM fund for building, strengthening and expanding the health systems. So one has to think out of box now, because this COVID-19 has given an opportunity. Honorable Prime Minister, the day before yesterday, when he was addressing the nation, he talked that this COVID has given an opportunity to make India self-reliant. So states have to be also think in terms of being self-reliant, and they have to think in terms of various ways how they can raise resources for building, strengthening and expanding the health subsystems. Because if, God forbid, this COVID-19, and as WHO says, would be a phenomena, nobody knows for how long it will subsist, then one has to be prepared at this very level. Preparedness is the key to fight any disaster. And preparedness does not mean that after a disaster has stopped, then preparedness is stopped. No, along with the response, preparedness goes on, capacity building goes on, everything goes on together, because it is an enemy, as Honorable Prime Minister has said, and against that enemy a war is being fought. And such enemies would be in the future, there may be so many enemies, we don't know how many enemies are lurking in the corners and they are waiting to strike again. So my point was with regard to health system building, strengthening, expanding in the context of disaster management. Now it has to be kind of visualized from the view of the disaster management, means prevention, mitigation, DRR, disaster risk reduction, capacity building, preparedness, response, then rescue, evacuation, relief, and lastly, rehabilitation, etc. WHO is saying, and I think the health specialists who are participating in this webinar will hear me out, that now the researches are there. I think WHO, some researches I read in some newspapers, we say that this COVID-19 would have long-term effect on the people who have been infected. They say that it's not only recovery, they recovered and now they are healthy. It's not the case. The lung diseases, the lung would be a problem in the future. So certainly need for their care. So it's very important that one should be also ready to face the future. This health hazard in the future can lead to more disasters. For example, the Union Carbide case. After the Union Carbide gas leak in Bhopal, lot many people died and lot many people got incapacitated, and still their rehabilitation is an issue. I know about the JE. Those who are affected by the JE, they feel they have this problem of rehabilitation. So the problem, is a lifelong kind of problem. So this COVID-19 is also going to give a long problem of rehabilitation, and I think the health system should be resilient enough to be ready to face those problems. Now, this convergence aspect, I will just say a little and then I'll conclude. Convergence not only at the grassroots level, convergence at the PSC level, convergence at the CSC level, convergence at the sub-divisional level, convergence at the district, state, and national level. Now, because there are so many departments, there are so many ministries, there are so many field formations who are directly related to the health. So, and panchayats, of course, administration, of course. So, how to make it an effective convergence mechanism so that the system works? I was just going through a message which has been submitted by one IS officer who resigned and working in the Kerala in the private sector. He says that the health system in Kerala was built much before this COVID-19, and one of the important, the take away he has mentioned was integrity of the people manning that health system. Says that perhaps the doctors, the paramedics, and the other health workers are devoted to their job. Devoted, I don't know how this culture of devotion has been built in Kerala. But this culture of devotion has to be built everywhere. Now the warriors, the doctors are working overnight. They are working 24/7 in all parts of the country. How to sustain that zeal? How to sustain that devotion? I think for the policymakers, it's very important. Can you provide some more material support? Can you provide more moral support to the doctors? So that this zeal is being kind of translated into a national mission, as a mission to serve the people in the years to come. This becomes very important. And whatever bottlenecks are there has to be, those bottlenecks have to be kind of softened through this convergence process, through the monitoring mechanism. I argue that monitoring mechanism to ensure that the system functions, system works, system is built, system is extended, system is expanded, is worked out, and we are giving the due importance to this monitoring mechanism. Now, I'll conclude by saying that once we have decided that health hazards now can turn into disasters, we have to, in the future also, think in terms of the various aspects, various components of disaster management, which are prevention, mitigation, disaster risk reduction, capacity building, preparedness, response, relief, evacuation, and last but not least, rehabilitation. If from this paradigm, we see the health systems now in the future, we would be in a position to face the disasters, to combat the disasters successfully, and save the mankind. This was, in a nutshell, my point which I wanted to share. Thank you very much.
Vyas ji, thanks a lot for sharing your valuable thoughts. You said that, as Prime Minister said, everyone has to think. Take away from your thoughts is that ideas have to be out of the box. One has to think out of the box. Not only center, but state, government also need to think out of the box. And as you said, that we need to build, strengthen, expand. And now we'll take questions also. We have questions for you, Vyas ji. Let me again tell about Vyas ji. Vyas ji retired from, he's a Bihar cadre IAS and retired from 1982 cadre IAS officer and retired, and he's working as a state chairman for this Bihar State Disaster Management Authority.
No, I'm the vice chairman of the Bihar State Disaster
Vice chairman of the Disaster Management. Yeah. Vyas ji, so first question to you is that it's from DC Pathak. Question is, will it be right to say that the challenge of this pandemic lies in the inability to explain the logic of social distancing and surface hygiene to the common man?
Yeah, that's why I argued that at the grassroots level, at the health subcenter level, where the common man interacts, with the health system, there's a need of now strengthening the public health and kind of capacity building of the staff so that all preventive measures which are required not only for the COVID-19, but to safeguard the the population from various health hazards is required. It should be made part of the habit. If it's not made part of the habit, and if it's made part of a drive, then this drive would fizzle out. So it has to be made a part of the habit. The hygiene, the sanitation, small things like hand washing, and if social distancing is required, the social distancing, how it has to be done, for the COVID-19. Maybe there may be other disasters, other health hazards, and for that you may need some other steps. So all these steps, all these mechanisms have to be transmitted to the grassroots through these grassroots institutions, and they can transmit only when they themselves are capable. The capacity has been built. Without being built, their capacity, it's not possible, and through convergence, of course. Anganwadi is there, Asha is there, school is there. If all combine together and share, the common perspective, then there would be change in the habits, and people would inculcate good habits, good healthy habits.
Okay. Vyasji, there's another question from Prince Assistant Researcher, PPF. Question is, the government has invoked the Epidemic Act 1897 and Disaster Management Act of 2005 to deal with the pandemic outbreak. The act is colonial. It's from the period old Century Act. Are these acts well equipped to deal with the unprecedented situation that we are facing?
In fact, the Epidemic Disease Act, which was promulgated at the time of the Britishers, but it has worked well, and before Honorable Prime Minister declared lockdown in the whole of the country, in the state of Bihar, the lockdown was already in force from 23rd of March under Epidemic Disease Act. It also gives a lot of powers to the appropriate government to give directions to the common people. So that was a sufficient act, and under that regulations were made. Under those regulations, states were acting. Now, Disaster Management Act in context of health pandemic, a health epidemic, has been used for the first time. I'm a little skeptical about the use of DMA. This time around, whatever is good for the nation has to be accepted by everyone. But perhaps it would be debated, amongst the legal circles, whether a disease means health hazards. Because prior to COVID-19, even NDMA, I'm working in the disaster management sector for last 11 years, nobody had ever that the health hazard can be defined as a disaster. For the first time it has been included. So, as on date, it's working well. Suppose somebody goes to the court, it's debated after this COVID-19 is over, and court gives the verdict that no, cannot, perhaps PIL has been filed. I don't know what would happen, thereafter. But as on date, Disaster Management Act and Epidemic Disease Act, they are working very well at the ground level.
Okay. Vyasji, one important thing what you said when you were keeping your thoughts, you said that integrity is important. You see, there's a problem with the integrity, but you gave an example of Kerala, how integrity, how they build up, and that was due to the devotion, that was due to the integration. So you see, it is a challenge.
Certainly challenge. I worked in the health, the Principal Secretary Health Department. I know it's really a challenge, but this COVID-19 has in fact given rise to to the best things in the human beings. The doctors, the nurses, the paramedics, they are, without bothering about their own health, they are, saving the lives. So this zeal, I think, which is are these good things which has come out during this disaster time, and they say that the best in the human beings comes out only when you're in the crisis. So there's a need of sustaining this zeal. There's a need of sustaining this integrity. There's a need of sustaining this devotion. And again, it's a challenge for the policymakers that how can they sustain it? If it is not sustained, then the good things which have come out, they would die down. They would peter off. So there's a need of kind of devising mechanism whereby this zeal can be harnessed, can be sustained in the future.
Okay, Vyasji, there's a question from KM Singhji. As you talked about the resources, where do we get resources from? Where do we build resources from? Say particularly in states. So how do we, is there, you see a challenge with the funds? How do we states build, come up with the funds for the health? When we face challenges like these, then there is no shortage of funds. Say from center is there, but states should have their own funds for this.
In fact, when I was arguing that states can also raise resources, in fact, in the mind I had this model of less charged by the central government on sale of diesel and petrol. When the roads were to be constructed, the National Highway Authority of India was constituted way back, I think in the early this millennium. I remember that government had imposed some cess for road construction on sale of petrol, sale of diesel and other petroleum products. And through that cess, a lot of money was generated, and that money is being used by the NHI. And now they are leveraging that money through PPP and so many things. So states can also, in fact, impose health cess, because we charge education cess. In every pie of land revenue, which is collected from the farmers, which is very little, of course, but certain amount is in the form of education cess. This land revenue may be the one of the sources, but there are so many sources at the state level. Excise is there, just GST part is also there, though GST council is to decide about that. But transport, says motor vehicles tax is there. So the states can, in my opinion, raise the resources through health cess. Even income tax, we are giving certain cess and all. So central can also take health cess from the income tax and all. So state can also impose this kind of cess, and they can raise the revenues. And I don't think people would mind. You are charging professional tax. Whoever is working in the government sector or in the non-government sector, they're giving certain percentage as a professional tax. So health cess can certainly be charged, and people won't mind. It can be 1%, 0.75%, whatever that may be. But there are, I think, the scope at the state level to raise resources. And number two, the PPP, the public-private partnership model. In my state, for the diagnostic services, this PPP model was in fact made effective when the new government took over in 2005. There are challenges also in the PPP in a state like Bihar, but those challenges have to be met. So PPP model, and third is the private sector participation. We don't have much private sector, but of course we have got so many institutions, so many so to say organizations which willingly would come forward to support this health sector reforms initiatives.
Ji, Vyasji, there's another question which is that ASHA and ANM both are already doing their work at the ground level. How can state government use their capacity where they are waiting for the salary of previous work? There's a question from Pooja, coordinator PPF.
No, ANMs are the government servants. Ashas are, they are voluntary, they say, and they don't give them salary from the treasury. They are demanding salary from the treasury. They are being paid on the commission basis. Suppose they bring a pregnant lady to the hospital for the delivery, then they are given certain amount. So it's based on their work and all. But ANMs are being paid from the treasury. There's no problem in the payment of salary to the ANMs. The issue is that we have to think in terms of grassroots level strengthening of the health systems. So if it has to be strengthened, then money has to be arranged. Resources have to be arranged. If we say that there are no resources, so they can't be strengthening, then we are doomed. I am arguing that, we cannot decide to be doomed because these are the challenges which we have to meet. My state, every year, the flood brings devastation and we fight the floods. We spend a lot of money. From where that money comes? Maybe coming from consolidated fund, and from where the money is coming from consolidated fund? From Government of India, from our shares in the taxes, and from the taxes which we are raising, or from loan, debt which we are incurring, through the Reserve Bank of India. So even there is a talk of, in fact, raising what is known as this deficit financing, raising funds to the deficit financing. Economists are saying that now the percentage of this deficit financing can be increased, so that, and if need be, Government of India can print more currencies. So many ideas are in the public domain. So for the health, once you have decided that it is a disaster, once you have decided that health hazards are no more hazards, no more only health issues, that the disasters, then disasters have to be dealt. The new situations give rise to the new solutions. So the new solution is that one has to raise, how governments have to raise, there are various ways one has to think out of the box.
Great. Vyasji, there's one comment from Vineet Chaudhary, which says that it's not easy to enact a central legislation on state subject. A proposal for a new Central Act of Public Health Emergencies is gathering dust in the health ministry. Some states have enacted their own acts.
Public health, I know that, Public Health Emergency Act, I'm not aware about any such legislation, but I think DMA Act has really worked well, unless until it is challenged and Supreme Court decides in its wisdom that, it cannot be used. But DMA Act, if one disaster has been handled, all other disasters, other health disasters can certainly be handled to the Disaster Management Act if there is need. And I think government may be thinking that the definition of disaster must be expanded to include even health hazards. Because I read out the definition of disasters, and disaster professional KM Singh Saab is there, will bear me out that so far NDMA has never thought that health hazards can be considered as health disasters. If I say so, even the man-made disaster like road accidents, they have been never thought as a disaster. If you go by the list of disasters which the central government has, in fact, circulated, road accident is no more a disaster. It's not a disaster. It has never been a disaster. Even lightning has never been a disaster. But lightning is disaster. In the state of Bihar, I am treating it as a disaster. We are doing whatever is possible under the Disaster Management Act. So we are helping the people in the name of local disasters. Okay. But prior to these local disasters, in the state of Bihar, we were providing ex gratia payments for the lightning deaths, under our own funds. So the states can certainly think in terms of if they need, kind of any legislation. But central legislation, Disaster Management Act has done a little tinkering here and there may be required. And if I share with you, way back, I think 5 years back, a committee was constituted to review the Disaster Management Act, and recommendation of, I think, that very committee is with the government. I understand that now Mr. P.K. Mishra was the chair of that very committee. He has done tremendous work. He moved around, in all parts of the country, and he solicited responses, solicited suggestions from so many professionals, the governments, the private sector, and his recommendation must be ready. It's possible that they may be thinking in terms of kind of making some amendments in the DMA, also in the context of COVID-19.
Okay. My co-host Rajesh, he's also there. He would also like to ask you a question. Rajesh, are you there?
Yes, I'm there, and with due apology to the other participants, and थोड़ा नाजायज फायदा उठा लेता हूँ co-host होने का, तो सवाल सीधे ही पूछ लेता हूँ instead of passing it on to you. Vyas ji, you have had an esteemed checkered career as a civil servant in Bihar, और आपने बिल्कुल सही बात कही अभी that हर साल जैसे हमारे यहाँ ईद, होली, दिवाली, बकरीद आती है, वैसे ही बिहार में बाढ़ आती है और उसमें काफी पैसे भी खर्च होते हैं. You said there's a lot of expenditure which goes on every year. यहाँ एक बड़ा गंभीर मसला है. There's a very serious issue which concerns the common man, which is corruption. Despite your very strict governance or control, there have been very serious allegations of corruption even during that disaster of flood every year. In fact, as a journalist, I did an undercover story of a top IS involved in one of those corruption scandals. I will not name him, and he is sadly not in this world also. His death is related to that. So मैं ये जानना चाह रहा हूँ, now we would all like to know, this is a different kind of a disaster now. That's a natural annual disaster of flood, and still that negative people could get into that corruption mode. Now it's a more complicated kind of a disaster management is needed when it is a biological kind of a issue, a virus issue. So would you like to give some suggestions to the civil society and also to the government based on your experiences, how to plug in those loopholes by the virtue of which we can take care of corruption? Naturally, we cannot eliminate it, but to the maximum possible level. Vyas ji?
In fact, the corruption you talked about was in 2004. I must say, I mean, it's not that I'm arguing, against whatever you have experienced, that so far as flood is concerned, in 2010, one standard operating procedure of dealing with the floods by the Disaster Management Act, by the Disaster Management Department, was made and approved by the Honorable Chief Minister. And if I say so that the funds are being transferred through RTGS by ensuring that there is a chances of less corruption. But of course, there would be, certainly if I say that 100% things have been improved, it's not possible. But I think the government is on the way to ensure that people are getting whatever they require. Bihar faces floods every year, and it is a great disaster in the sense that out of 38 districts, 28 districts are flood prone. And unfortunately for us, if monsoon is bad, but if monsoon is good in Nepal, then we, in the same year, we face flood in certain parts of a given district, and we also face drought in certain parts of the same district. So flood and drought, they go hand in hand. But there is a standard operating procedure not only for the flood, there is also for the drought management in all. These standard operating procedures start with preparedness, how you prepare, and party in which I am working, we work for the prevention aspects. We also work for the awareness aspect, training aspect, capacity building aspect. So these things are, going on. So far as this COVID-19 is concerned, I think there is a need of, and I think in my state may be working, to prepare a standard operating procedure not only for COVID-19, but for also health hazards. Under the AES, in 2012, there was acute AES situations in, I think, number of districts. A lot of people died. We prepared what is known as, because the virus of that AES is not known. If the virus is not known, so the JE virus is known. So if virus is not known, you cannot do anything to contain the AES. But there were treatment protocols developed worldwide, and we also consulted CDC Atlanta, and government approved one treatment protocol known as SOP, Standard Operating Procedure, for treating AES. And now they have revised that protocol, and based on that protocol, AES is being treated in the hospitals, and proactive steps are being taken, wherever there is any chances of its recurrence. For the COVID-19 also, I think SOP has to be prepared, and I know that government is on the job, that some SOP for managing the shelter houses, SOP for quarantine, etc., are being prepared. So based on the experiences which one has gained in the field of disaster management, once you decide that yes, that this epidemic has acquired the proportion of a disaster, then one has to prepare SOP, and SOP in fact means preparedness. It means reduction of the disaster, risk reduction, mitigation, capacity building, and so many things. And of course, it also builds a system where even this corruption can be taken care of. And if a state government is not transparent, if a state government is not in fact entertaining any grievances, then certainly corruption would be there. I believe that every state government, including the government of Bihar, is entertaining the grievances, in spite of the fact that we see daily thousands and thousands of the migrants, they're walking, here and there on the roads, they're dying also. We are seeing that. But certainly this is a challenge, and I hope that this challenge can be tackled by building resilient systems, procedures, SOPs, plans, and policies.
Vyasji, a very brief observation. Dineshji, if you permit me to just make a...
Please, go ahead.
Actually, as a journalist, as a true journalist, we are supposed to criticize the government's policies, and at the same time, we should also appreciate if the right thing has been done. The criticism would help us improve our SOP that Vyasji is talking about in future, and appreciating a point would help us make that thing more strong. So I'll just like to share a small instance of how during this COVID-19 crisis, I had a conversation with a very poor farmer who is also a relative of mine in a village in Bihar. And he informed me, I was just checking that you have not got, and his monthly salary is barely 3,000 or 4,000 per month. And naturally, he wouldn't have got the salary for 2 months. So I just asked him, कि पैसा है आपके पास, 2 महीने से पैसे नहीं मिले होंगे, स्कूल पे नहीं मिला होगा. He said कि जाना है 2,000 करके 2 बार हमारे जनधन अकाउंट में पैसा आ गए है. I would translate it for our audience. He would delighted to share that there were 2 installments of 2,000 rupees each transferred in his Janadhan account since this lockdown. So, I mean, I wouldn't exactly know how exactly it had happened, but somehow in this lockdown, or just to as a crisis management or to help the poor, there have been certain money that was transferred directly to the concerned, the victims or the people who needed those helps. So maybe this kind of a structure that government, that I could have a first-hand experience of knowledge about, Vyasji, because it's your state as well. So do you think it can be strengthened more in such disaster management or helping the needy in future?
देखिए, जो 2000 की बात कर रहे हो, सेंट्रल गवर्नमेंट ने जो किसान सम्मान निधि के तहत पैसा भेजा होगा, स्टेट गवर्नमेंट ने हमारे अब तक 20 लाख माइग्रेंट वर्कर्स को उनके खाते में 1,000 रुपए ट्रांसफर किए. 20 लाख रुपए किनको गए? जो प्रदेश के बाहर रहते हैं, people who are migrant workers working elsewhere through this DBT. So it's but natural that there are very few people who may say that they are left out also, because government decided that people have to get themselves registered, and after registration it would be checked up whether they are migrant workers or they are not. We got a scheme to help the migrant workers. It was, in fact, if I say so, that it was formulated way back in 2007 when I was working in the labor department, because government wanted that something should be done for the migrant workers. If any migrant worker which is skilled outside my state, his family is paid 1 lakh rupees. Now you might have maybe hearing that a lot of accidents are taking place in Madhya Pradesh and Uttar Pradesh, and 6 of our laborers have been perished in those accidents. So they are also being paid in their account, but there is a system that someone has to claim that money, someone has to procure one certificate of being the dependents. So that way governments are certainly trying to ensure that money reaches in the accounts of the persons concerned. So through this DBT, I think this corruption part would to a large extent would be tackled. But grievances, all grievances can't. If I have not got that money, I will say कि हमको तो नहीं मिला. I will say और अगले को मिल गया, गलत मिल गया उसको. In the flood relief, I have worked in the Madhubani district. I started my career, way back in 80s in the Madhubani district, and I found that if you provide relief to A and not to B, and suppose B is not affected person, B would complain. He'll say that A has been wrongly provided, why not me? So it would happen, these grievances would happen. But now saying, suppose A says that I have to pay certain amount to the government officials for getting this relief, it's a corruption. It's a corruption. So this corruption is being tackled through RTGS. I mentioned about RTGS. Since I think 2015 earthquake, which in fact caused devastation in Bihar also, 58 people have died. 78 people have died. And from there on, government decided that through RTGS, not through check. Earlier the payment was through the check. Now it was decided that we'll make the payment through the RTGS system. Then the money was being transferred to the accounts. Now the DBT has come and money is being transferred. So learning from the past experiences, even this corruption is being started. There should be a will, and if governments are not showing will, corruption cannot be contained. If they're showing the will, and there's little corruption or no corruption at the top level. If there's a corruption at the top level, certainly there would be problems. I mean, we have worked in the government, and I can say that if at the top level people are not corrupt, they are very strict, the corruption would be contained to a very large extent because the system still functions.
Thank you, sir.
That's my argument.
Shri Vyas ji, you rightly said that there has to be will, and that will has to be shown at high level. From the higher level, it should travel to the lower level. There's another question, Vyas ji. How sustainable will it be in the country like ours with such dense population, and how will authorities at center and state and grassroots level help achieve the same? With the people of India will be having a huge role to play. What shall be the way forward?
The way forward would be the convergence I mentioned about. At the grassroots level, there are panchayats, there is a panchayat system in the villages. At the urban level, there are elected bodies. So this convergence becomes very important. If you're involving the people in the disaster management, and if you're transparent, certainly kind of mutual trust would emerge. And if you are not, involving the people, you're being aloof from the people. You're not, say, for example, solving the grievances of the people, redressing the grievances, not hearing the people. Certainly there would be mistrust. Just you mentioned about the journalists. In my SOP, for the flood, we have mentioned कि अगर किसी अखबार में या टेलीविजन पे कोई शिकायत आप सुने, इमीडिएट जांच करें, और अगर वो सही पाया जाए तो रिड्रेस कीजिए, गलत पाया जाए तो भूल जाइए, क्योंकि पत्रकार का काम है उसको कुछ सुनाई पड़ा उसने डाला, बट हो सकता है सही, और हमारे ईओसी में, इमरजेंसी ऑपरेशन सेंटर में टेलीविजन के सेट लगा दिए गए। एक आदमी देखता रहे, अगर कोई चीज कहीं से आ गई और अगर लगता है कि द पीपल आर इन प्रॉब्लम, from the information if from any sources, if it reaches to the administration, I think it's part of the good governance to act on that information. At least you find out whether it is a credible or not. If it is a credible information, then administration has to act on that. Only then the people would have the faith over the administration. And it is a Herculean task. It is not very easy, but it can be done. It's not that it can't be done. It can be done. I remember in 75 emergency, we talked many things about emergency, but one of the points of the 20 point was sensitive administration. Samvedansheel Sarkar Prashashan. So this Samvedanshilta, this sensitivity, in my experience also, is very important. If, the gone are the days when the administration, the Indian Administrative Service and Police Service people, they are thinking that they are the kings. Nobody is king now. The people question the kings. The people questions those who pretend to be the kings. They are servants. Now, certainly if government would ensure that the servants work as a servant, certainly they will work. If government, is oblivious to any criticism, the servants would become the kings, but it will go on. It's not a, if I say that it would be solved tomorrow, I would be wrong to say. It's a process. And I think process is going on. The democratization is going on. I know in Bihar, the villages, the people are very conscious. People question the authorities. If this questioning is welcomed by the authorities, I think there would be more and more trust.
जी, वैसे do you think this is happening? ये आपको लगता है कि ये हो रहा है या इसमें अभी भी दिक्कत है? अगर कोविड-19 और हम पोस्ट कोविड-19 देखें जो अभी हालात है, उसमें आप इसको कैसे देखते हैं? ये हो रहा है क्या?
ऐसा कि ग्रीवेंसेस बहुत हैं, खास करके माइग्रेंट्स के। अभी जब मैं आपसे बात कर रहा हूँ, तो मेरे पास फोन आया हमारे अथॉरिटी ऑफिसर्स का, एक टीम बनाई गई है हमारे द्वारा, जो गवर्नमेंट से अलग कुछ काम कर रही है। उन गरीबों को, माइग्रेंट वर्कर्स को, कमिंग ऑन फुट, आर दे कमिंग ऑन द ट्रक्स, और साइकिल्स, दे आर प्रोवाइडिंग देम फूड। वो कह रहे हैं कि मतलब समस्या बहुत ज्यादा है, एंड इवन दैट फूड इज बीइंग अरेंज्ड थ्रू द पब्लिक पार्टिसिपेशन। द इशू इज के बावजूद इसके समस्या इसलिए है कि lakhs and lakhs of migrants are coming from various parts of India. भूखे लोग आ रहे हैं, प्यासे लोग आ रहे हैं, थके हुए लोग आ रहे हैं। आप जब ग्रीवेंसेस हर लेवल पे हल न करेंगे, तो जहाँ पे बिहार में पहुंच रहे हैं तो परेशान हाल में पहुंच रहे हैं। पुलिस अगर उसको, एक इंदौर में मेरे दोस्त हैं जो पढ़ाते हैं, यूनिवर्सिटी में प्रोफेसर हैं, उन्होंने एक कहानी बताई जो मैं इसलिए कहना चाहूंगा। बहुत सारे उन्होंने बताया कि खाने के सामने से एक माइग्रेंट का परिवार गुजर रहा था जो महाराष्ट्र से आ रहा था। उस थाने में एक महिला पुलिस पदाधिकारी थी, शी वाज सब इंस्पेक्टर ऑफ पुलिस ओवर देयर। उन्होंने देखा कि द लेडी हु वाज वॉकिंग विद हर हस्बैंड, एंड शी हैड अ परहैप्स 12 years old daughter also, and she was थोड़ा उसको चलने में परेशानी हो रही थी। सो दैट पुलिस ऑफिसर स्टॉप दैट फैमिली, थाने में बुलाया। पता चला कि 2 घंटे पहले दैट लेडी हैड डिलीवर्ड अ बेबी, और 2 घंटे बाद ही वह पैदल चलना शुरू हो गई। ऐसा आप सोच सकते हैं, ये मन को मथने वाली चीज है। व्हाट दैट लेडी डिड, आराम कराया उनको, ना कुछ खाने को मिला है, नहीं मिला है, 2 दिन से भूखे हैं। डिलीवरी हुई है, सोच लीजिए आप, 2 घंटे पहले 2 दिन से भूखे हैं, खाना खिलाया। एंड दैट 12 years old जो उनकी बेटी थी, उसके पाँव में चप्पल नहीं थी, उसने चप्पल खरीद के दिया। और कहते हैं हमारे दोस्त को लड़की नाचने लगी, पहली बार जीवन में उसने चप्पल पहना। सो दिस इज द लेवल ऑफ पॉवर्टी व्हिच इज बीइंग मैनिफेस्टेड ऑन द इंडियन रोड्स, right from Kerala to Bihar and other parts. So when these people are walking on foot, being given some transport somewhere, or someone has served them khichdi, certainly they are in trouble. अब इतने लोगों के ट्रबल को जब आप यहाँ पे हल करने बैठते हैं तो दे आर फुल ऑफ grievances, full of grievances. They need compassion. So the administration has to provide that compassion. Now, and I am happy that during COVID-19, administration has got this opportunity also to serve the people.
बिल्कुल बिल्कुल आपने सही कहा कि डिवोशन, और जो आपने सबसे अहम बात की थी कि आपने एग्जांपल दिया था, यू गिव अ एग्जांपल ऑफ केरला, दैट इंटीग्रिटी एंड हाउ दे build it up. Vyas ji, there's a other question which is from Manika, and that question is, Manika is she's asking about the capacity building. I'll just give me there's some problem. आपने हम लेट्स कैरी इट फॉरवर्ड. जो आपने ये डिवोशन, ये जो बात की आपने कि देयर इज अ प्रॉब्लम कहीं पर, देखिए ये जो माइग्रेंट्स वाला प्रॉब्लम है, लेबर वाला प्रॉब्लम है, दिस इशू, दिस हैज बीन डेल्ट. It depends from state, it depends from officer to officer, it depends from person to person. लेकिन इस तरह का डिवोशन, इस तरह की इंटीग्रिटी, आपको लगता नहीं कि इसको डेवलप करना, कई जगह इनबिल्ट होती है, कई जगह ये बिल्ड की जाती है? आपको नहीं लगता कि दिस इज ऑल्सो अ चैलेंज, एंड दिस इज व्हाट व्हेन वी मूव, एज वी आर मूविंग फॉरवर्ड, दिस इज अ चैलेंज फॉर इंडिया?
No, certainly it is a challenge for India, because every person cannot be, two persons can't be similar, But the issue is that of building a system. If a system is properly built, and if that system starts functioning, and if there is a proper monitoring of functionality of that very system, administration क्या करता है? We plan, we execute, implement, and then we monitor. And we control, of course, management, that this is the job. So if at the level of control and monitoring, it is being monitored and it's planned well, certainly, I think, if not 100%, then 50% problem would be solved. For example, for the migrant workers, if you are running the special trains, there is a system, some people are coming, but there are lakhs and lakhs of people. All lakhs and lakhs people can't be transported at the same time, so they would have the grievances. But if they are being treated well while traveling, even on the roads when they are traveling, if they are being treated well, then certainly they would have a good experience of the administration. And suppose the administration is stopping them at the borders, using the force, then certainly there would be a kind of clash of the people's interests with that of the government. So this is a challenge. This is a great challenge. I mean, it's a great challenge, but the job of the governments and the job of the administration is to face that very challenge. Honorable Prime Minister told in his speech that we have to turn this challenge into opportunity. How you will turn the challenge into opportunity? Certainly you will turn the challenge into opportunity if you are building proper system, proper functional system. And I think the successes or failures of the mixed reactions, of the mixed results of management of this COVID-19 has given everyone, right from the community to the government, experiences how they can build the systems, how they can build their own resilience, how they can build their own immunity also. In Bihar, we find that our recovery percentage 2 days back was more than 50%. Why? There's a poverty, but it means the immunity of the people is very, very strong. That's why they're getting recovered. Everybody says that there's no medicine, but why people are recovering? In India, 33% recovery rate, which is a good sign. It means people have got the immunity. In spite of everything, people have got the immunity. So the challenge is how to sustain this system, how to build this very system based on the experiences which you have been having. If you consider that no, I have succeeded, then you won't be in a position to build a system, a system. You accept that yes, here I have failed. There was no preparedness. I have to be more prepared now. From the day one, if there was no preparedness, from the day two there would be preparedness. So preparedness in a disaster management is a continuous process, and it's leveraged on the experiences which I gained. So I believe that based on the experiences which we are having while managing this COVID-19, the system would certainly improve, because there's no any other way out. Because this COVID-19 is going to persist for a long period. So everyone has to certainly, build upon the experiences and build the systems.
I'll take a last question. This question is biological and public health emergencies added as part of NDMP in 2019. However, within 2-3 months, there was a need to implement various short-term and long-term objectives. In what manner the lessons learned from this crisis will help in this future execution and will be able to achieve objectives comparatively sooner now?
Look, with regard to NDMP, I have got my reservations.
Sir.
This NDMP was prepared without consulting with the state governments. There was no consultation. I was in the disaster management department since 2016, and thereafter I'm in the authority. We were not consulted at all. Any plan, it can't be fit to all. In the context, the states have to be taken care of. So this NDMP became a document. Okay. So this document has to be, in fact, made a functional document. I think this NDMP must be revised, and they may be revising also. At the state level, I have got SDMP, plan. I formulated way back in 2012. Now, in that plan, I never included these health hazards, because health hazards were not considered as disasters at that very time, or even prior to COVID-19. So my point is that whatever plan we are formulating, number one, that plan should be made with due consultation with the stakeholders. NDMP was not prepared. If I say so, please permit me to say so. Kem Singh Saab is there. Perhaps he was not in the authority that very time. Sir, there was no consultation at all, even with the SDMA like Bihar, which is doing, a lot of work over here. But SDMP, when every state is to prepare, like we prepared it through a lot of consultations with the stakeholders. So, based on this COVID-19 experience, I suggest and I hope that this NDMP would be revised in consultation with the state governments, with other stakeholders, with the community at large, and it should be made functional so that based on the NDMP, the SDMPs are also revised. Once SDMP are revised and DDMPs are there at the district level, there is a district disaster management plan. These DDMPs are still in the formation stage, because we are working on that, I can say very safely, but NDMA may say, that all districts are prepared at DDMPs. It's not the case. They may be the drafting stage. Someone has drafted, but they have not included whatever is needed to be included in that. So it's also a continuous process. Plan is made, it's revised based on the experiences. So NDMP has to be revised based on this experience through stakeholder consultation. Then SDMPs have to be revised. DDMPs, wherever have been approved, have to be revised. Only then the spirit of NDMP would come down to the grassroots level, and implementation would become much, much easier.
Okay, thanks a lot, Vyasji. Whatever you said, that NDMP needs to be revised. Hope the authorities will listen to the valuable inputs and thoughts which you have shared. And thanks a lot for joining us. And before ending up, I'll say that today's sessions, these sessions were would have been very valuable to our audience, to our viewers who have joined us. And I thank again Vyasji for joining